So obviously that will change a lot of things. Just comment briefly on the governor's change that he put out a couple of days ago with respect to sports and outdoor venues, indoor venues, etc. You know, we've had some outdoor venues that have had some sporting events and outdoor activities, and I really want to thank and congratulate the parents and the fans of those different high school events that have occurred. The reports we've been getting has been almost universal mask wearing, social and physical distancing, and people cooperating. And as the governor has started to open up things with college sports and our Steelers fans, the same ask remains. I mean, if people continue to cooperate, we know we can do a lot of functions safely, and we can do a lot of functions that could even open up even more. And if they don't, then I'm sure the governor will probably go the other way and start to close things down. We don't need any better example to see what happened in the Rose Garden a little over a week ago to know that if people don't follow distancing, it can spread very quickly. Obviously, that's a very, very public, and those are a lot of public figures who are in the news all the time. Not everybody is, obviously, at some of these events that we have around locally, but the spread can be just as fast. So anyway, let me turn it over to Dr. Bogan to give her weekly update. Dr. Bogan.
Good afternoon, and thank you for joining us again today. So again, I'm here and very pleased to report that our case numbers continue to look quite steady. There is still, however, the rate is up just a little bit, 1% to 3.8%, which is about where the state is overall. And the health department continues to conduct case investigations and to trace the contacts of those cases. And because of this, we're able to identify, intervene, and potentially slow some of the outbreaks and clusters before they get out of hand. In the last week or so, only about 10% of our new cases were associated with an outbreak or a cluster. And about half of the cases last week reported having close contact with a known case, which means that 50% of people or cases are from community spread. And that is why it's extremely important to continue to be cautious when out in public and to follow sort of the guidance that we've been putting forth for the last many months. From the information gathered through our case investigations, our outbreaks and clusters have been connected to schools, events such as weddings, parties, and funerals, and places of employment. So again, I want to stress that we can't let down our guard. Our numbers are steady due to the hard work and our residents. And I will say, when I'm out in public, I have noticed lots of notices in businesses to wear your mask before you go in, and I'm seeing people wearing their masks and really respecting the physical distancing recommendations, so thank you. And with that continued vigilance, we can get through this fall and winter with limited cases, hospitalizations, and deaths. We do have vaccine trials continuing in our community and across the country and across the world, but it will be a long time before most people have been vaccinated. So for now, please continue to do what we know works. Wear your masks properly whenever you're around others, especially indoors. Keep your physical distance from others, wash your hands frequently, etc. I wanted to spend just a minute updating you on our community test site down in McKeesport. I'm happy to report that our testing numbers are increasing down in McKeesport. For the last 2 days, we've seen over 80 people being tested at that site. We really want this location to be accessible for anybody who needs to get a test. So it's fast, it's easy, it's painless, it's great for kids. We are testing kids 3 and above. It is free, and there is no prescription or referral necessary. And starting next week, we've extended some hours to cover evenings and weekends to allow accommodating more people's schedules. So here's the schedule for the next 2 weeks. We will be closed on Monday, but we will be open Tuesday from 10 a.m. to 4 p.m. Wednesday and Thursday, we will be open from noon to 7 p.m. And Friday and Saturday will be open from 10 to 4. So again, we're trying to increase hours to make this accessible to anybody who needs a test. I just want to spend a few minutes today also addressing children in this pandemic, as our children are going back to school. So in September, we reported 233 cases of COVID-19 among children ages 0 to 18. And so far in October, we've had 67 cases among that same age group. Of the cases among children in September and October, only one child has been hospitalized. And since the start of the pandemic here in March, 14 children have been hospitalized. So here in Allegheny County, like we've seen elsewhere around the world, children in general really experience much less severe illness. Yet some do get quite sick and get hospitalized. And although it's uncommon in children, it does happen. And as if case numbers increase, we will certainly see an increase in those more serious events in children as well. Across the state of Pennsylvania, there have been over 17,000 cases of COVID-19 among children birth to 19, and there have been 49 cases of multiple inflammatory syndrome of childhood. And this is a very serious and can be life-threatening illness. And we really don't know the long-term consequences yet of having COVID-19 in childhood or of MIS-C in childhood. So again, rare event for children to get very sick, but we do know that they can spread the virus as well. In our case investigations, we have definitely seen outbreaks that involve children. And one outbreak we've been monitoring for the last 3 weeks started with a teen and has now spread to 27 people. So we know children can spread the disease to their parents and their grandparents, their relatives, their caregivers, their teachers, and their coaches. And these individuals, of course, are adults, and we worry that they can develop the more serious illness than most children experience. We also know that this pandemic has been hugely disruptive to the lives of children. And we know that for children, play and school and socialization are very important and key parts of their lives. And so we want to make sure that children have those things in their lives, but that they do it safely to really limit the spread to other people. So again, some ideas that have been brought up in the past to form pods with other families that keeps your gathering small. You can keep play dates outdoors if possible. Have your children wear their masks. Have them wash their hands. And when they're eating with other children, again, they can sit down, physically distanced, and then get up and put their mask back on and play again. So again, we want children to have those opportunities. It's really important for their health and well-being, but we want them to do it as safely as possible. And throughout this pandemic, I've talked about physical distancing, not social distancing. It's important to remain socially connected, to get through this together, and to stay healthy. So I want to encourage you all to take care of yourselves, your friends, and your family. Take care of your mental health as well as your physical health. And remember to stay safe and to be kind. I'm happy to take questions.
This first question is from Gazette 2.0. Many people think that a person's blood type will impact their ability to contract the coronavirus or impact how severe it may impact them. I found studies on both sides of the argument. Does someone's blood type impact how they will handle COVID-19, and what does the research say?
So my understanding of the current literature is that blood type is not really a significant factor in the severity of COVID-19, but we do know that there are some risk factors that do make the disease much more serious, and that is having overweight or obese status, smoking is a risk factor, type 2 diabetes, and other things. So not blood type specifically.
This next question is from the Post-Gazette. Have COVID-19 testing supplies been an issue, limiting or delaying the number of tests done?
Recently we really have not seen that testing equipment or access to testing has been a problem in our community. Again, we have our test site open. Our federally qualified health centers continue to do a large amount of testing. We have test vans. We have testing going on in our long-term care facilities and other places. So we really have not seen a shortage recently.
This next question is from WESA. Coronavirus infections are rising again in Allegheny County and throughout Pennsylvania. What does the case investigation data reveal as to why this is occurring?
So, I would argue that we really haven't seen a large increase in our cases here in Allegheny County. We've really been fairly steady for a long period of time. And our case investigations really continue to reveal the same thing. When people who know one another get together in parties and in weddings and funerals and places where you know one another, we see much more spread of the virus. And again, I think that's because people get comfortable with one another and they relax and they take their mask off and get close. And probably spend longer periods of time together. So that's what our case investigation continues to show, that it is really amongst friends and family that we are spreading the virus.
The next question is being provided from two different outlets, WTAE and Pittsburgh Business Times. If you would, please react to Governor Wolf's crowd size changes announced yesterday, specifically what you think that means for high school sporting events. Does the change make you more concerned about community spread? And what are the things that parents and others who do go to these games, whether they're Steelers or high school, should know that can keep them safe from COVID?
So I think you all know that the new guidance put out by Governor Wolf was really based on capacity. And so the capacities are such that people really can spread out in these venues. And that's what I really encourage people to do, right? Use the entire venue and spread out as far as you can. Sit with your household contacts. Don't sit in large groups. Wear your masks. We've talked about the effectiveness of shouting and singing and exuberance, so spreading the virus more effectively. But again, these venues are mostly outdoors, and again, outdoors is a much better place for people. There's much less spread. So wear your mask, sit in small groups, spread out in the space. Sit with your household contacts. I'll also put a plug, I've said this many times, to limit alcohol consumption because we know that as you drink more alcohol, you lose your inhibitions and you tend to shout more, take your mask off, lose that physical distancing that we recommend. So again, limited small amounts of alcohol, but really try not to party it on too hard.
This next question is from WPXI. A number of gyms in our area have begun to move towards normal operations. Has contact tracing shown any cases recently from gyms?
We see a number of cases every week from gyms. It rises and falls. We'll see a tiny number, then a bigger number, but it's never been a big part of the cases, and we haven't really seen any clusters or large outbreaks from gyms at this time.
This next question is from Gazette 2.0. As it relates to herd immunity, if a vaccine is several years away, how long would it take for herd immunity through natural spread of the disease to take? How dangerous and deadly would that process be? And if we're gaining herd immunity through a vaccine, what percentage of the population would need that for herd immunity to take effect?
So first of all, I don't think we're going to have vaccines. I hope we'll have vaccines in a couple of months actually for high-risk groups, but it's going to be a long time for everyone in our community to be vaccinated. So I don't want people to rely on herd immunity as a form of preventing spread. As I said, we really need to be using the things we know work. So that is wearing your masks, keeping physically distanced. And we also know this virus is quite dangerous and can be very ill for some people. So again, relying on herd immunity and the idea that you would let this virus just go wild and let everybody get sick and get herd immunity through natural immunity is really horrifying to me because, again, we know, like, if you compare this to influenza or even H1N1, this is orders of magnitude more deadly for people. We don't know how much we need for herd immunity at this point, and so I can't really answer those specific questions about how much do you need, but I'll just remind you this is a very dangerous virus, especially to high-risk populations, and we need to do everything we can to prevent the spread of the virus to large numbers of people.
This next question is from the Post-Gazette. Can it be assumed that roughly the same number of COVID-19 tests are being administered week to week in Allegheny County?
So on our COVID dashboard, we have the numbers of tests given each day in our county. And again, there's often a lag on reporting. So if you look, back a week, we see a range. We see fewer on the weekend, more during the week. And we range somewhere between 700 or 800 and 1,100. Typically, it goes up and down. But yeah, we've been seeing so steady numbers of tests in our community for quite a while now.
This next question is from WESA. How concerning is it that cases are increasing? Right now, the rise in infections appears to be modest.
Yeah, again, I don't think we have seen a large increase in our cases here. We've had a steady number of cases. There's some day-to-day variability, but if you look across weeks, our total numbers across weeks really have not been going up very much, despite people being back at school, being out in the community more. And again, I'm thrilled, and I think that really is attributable to all of people wearing masks, keeping physically distanced, and really following the guidance. So it's great.
These last two questions are from WTAE. The city of Pittsburgh and other municipalities are moving forward with trick-or-treating. Are there specific steps that parents and children can take to prevent the spread of coronavirus?
So I'm smiling because I think of trick-or-treating as very fun, as well as everyone else out there. So I did see the guidance put out by Pittsburgh City, and I thought they were quite good. Again, similar to their guidance, I would make sure that people are wearing face coverings that are appropriate, like face masks and others. Bring hand sanitizer with you, wash your hands frequently, keep it outside rather than parties inside. Again, we talked about this last week, trick-or-treating in small groups, not in large groups, not lingering and hanging out, but just moving efficiently through the process. So yeah, I think you can do trick-or-treating quite safely if you are careful and follow those guidance.
And this final question again from WTAE. More school districts are moving to 5-day-a-week in-person learning. How do the local infection rates factor into those decisions, and are districts following the advice of the health department for reopening?
I'll remind you that the health department doesn't give guidance on school reopening. That really falls to the school districts and their boards of education and things like that. We really provide guidance about what to do if there's an outbreak and how to help and how to prevent spread in those schools. And again, we've had schools now open for over a month, and we have not seen a big increase in our case numbers here. So I really appreciate all the hard work that was done in planning for those schools, the cooperation the schools have had with us and our Department of Epidemiology, and calling our department when they have cases, so we can again do case investigation and contact tracing and keep those cohorts of clusters of cases very small. I really congratulate the schools on doing a good job, and we will continue to monitor really closely. And as soon as we have cases in schools, we call and work with the school closely to try to limit the spread. So I hope that will continue in that fashion, and so that we can keep our children in school as much as possible.
That was the final question. If there are any other remarks.
Well, thank you, Dr. Bogan, and really thank you on behalf of this whole region. You and your team, the advice you have given has kept this region safe, and we want that to continue. So the advice that Dr. Bogan gives every week and throughout the week for different things that go out on the website and on Allegheny Alerts, et cetera, are there to keep us safe. And for the vast majority of people in this region and this county, they've been following that advice. We've got some new things, busy things this weekend that I think everybody needs to be very, very mindful of and careful of. Obviously, the Friday night football that we've had a number of weeks, people keep going to those games. And again, the cooperation for the school districts and the parents and the family members have really been wonderful. It's been a great example. We're also, for the first time, going to have satellite voting that's going to occur in Allegheny County at a number of sites around the county. It's the first time we've ever had it here in this county. And if you see what's been going on around the country and even around other parts of the state, there's a lot of interest. People are showing up. There's lots of people doing it. Wear your mask, physically distant, go do the 6 feet everywhere in line. We've got a lot of workers that are going to be there all day long, our election workers who will be staffing that operation. And we want certainly everybody to have the ability to do that. But I would again encourage people to vote by mail. You still have a number of weeks in which you can apply at AlleghenyVotes.com. Over 60,000 of your fellow Allegheny County residents have already voted. Those votes have already been received and be recorded. It's as safe as can be. You don't have to worry about social distancing in your own at your own kitchen table or at the mailbox. So we encourage people to continue to do that and be safe. And again, on election day, it's going to be a big turnout. So the more people that vote by mail, that means the less people will be in line. crowding into our polling places around Allegheny County. And then, of course, our Steeler fans and our college football fans. We certainly, there's going to be a lot of eyes on you, and there's going to be a lot of attention to those 4,000 or 5,000 fans that are going to be at Heinz Field. And we're just asking people to cooperate. Please wear your masks. I'm sure the governor would like to, maybe for the next game, allow more fans to go in. And if we do it safely, I think that's the opportunity to do it. As Dr. Bogan said, being outside is certainly helpful, but it's not everything, because we saw what happened outside in the lawn of the White House, where over 20% of the people who attended that event have already come down, and we know it's going to be more than that. But it was really people, like Dr. Bogan said, who felt comfortable with each other, spending time together, were close to each other, and weren't wearing masks. So if even in your own backyard, even with your own friends and your own family, if you're gathering with relatives, etc., please follow the advice, stay physically distant while socially being connected, and wear your mask. And again,